Hi, this is Berta again, hypnotherapist myself and supporting other practitioners in this industry as well. And in this video, I want to address a very important moment in hypnotherapy, which is after the session with a client. And that because it is raised as a question by few practitioners related to few things. But initially, I will quickly say a few words about something else that no matter in what kind of change work you're involved in, so to speak, you could benefit from this too, hopefully. And that is how to take worry out of the equation. You see, throughout the video, it should become even more clear why am I saying this. Now, that is understandable, especially in the beginning, as I have as well experienced it, especially the first year of my initial training. I recall to have sometimes even cried with some demos while we were learning the skill, but it changed as soon as I started working with clients because of the results I could see them achieving. Also, especially as the majority of therapists that I speak to, I know are so caring and empathic and all that, But isn't it ironic that that's exactly what we try to convey to our clients to stop worrying by stop trying to control what is not in their hands? And yeah, there's so much to this sentence as well, as I mentioned in the word trying, and more about it in another video, but they will be related throughout the content. And then we do the same in relation to our clients. We start worrying to an extent that is way beyond of what is possible for us to control in clients' life after the session or after a session. To just recall the difference between empathizing and sympathizing, as you may know, one is to be involved emotionally and somewhat also be taken or shaken by someone else's story. And in this case, um the by the client's problem in therapy, and the other is to recognize the weight of the problem, which you do, acknowledge the client's experience, which you do too, and be glad for them coming to a place that they have been able to decide to overcome an issue that they no longer wish to have in their lives. Now, to move forward, the worry of these practitioners in these particular cases was about the client's experiences post session. And again, ironically enough, not worrying will oftentimes speed up the client's results, as counterindicative as it might sound. That is because you will avoid interfering with the processing time after a session. But since the session had gone wonderfully well and all done correctly, this worry seemed sort of valid. And the dilemma of few of them, because actually they are really very good to think of such a thing, was if they had perhaps not been managing the client's expectations somehow correctly. Now, also to think that you can manage all expectations would also be too much. However, there are some points that I will be mentioning later on to have some good grounds on setting the client up for success. And in these cases, they had been telling, the clients that change can happen in few ways, like it could be instantly, progressively, and in a retrospect. However, even this could be too generalized for knowing how the conscious learns versus how it protects us. And as a language as well, it is also not so easy to grasp for people which are not therapists. But let's say the therapist had made a really good point about it and the client have understood. Now, it's often talked about setting yourself up for success as a therapist, but very little about setting the client up for success, which is to some extent also a part of setting you up for success as well. So here are some points to make on how can that be done. The conversation with the client after the session, as I mentioned earlier, while still on the call if you're working online or while at your practice, is immensely important. However, its effectiveness will also depend on many other elements, starting from the pre-session moment, not even from the start of the session, but before it altogether. Here's what I mean, and what you would want to know before a session. That would, as a reference, affect the chat about clients' expectations after the session then. It's a pretty direct question, like what do they expect to gain in working with you? And most probably, for example, they might say, I want to get rid of the anxiety or panic attack or gain more clarity on something. So, whatever the symptoms, be free of those symptoms. While you know that there are symptoms and there's an underlying issue, that question is not about it. While you want to know all these details and explore that too, like to have a better idea overall, but that is mainly done in the session. Like, how is that really playing out in a client's life, or why now, or how important is it for them to be free of it? However, when you ask that question before the session, oftentimes the response can be around the problem. And in that particular case, they have come up with multiple problems. What you should be careful, though, is, or pay attention to, is not to be swapped out by becoming overwhelmed with the complexity of the issue. And remember to either make a separate question afterwards or make it clear to the client that you ask them about their expectations in terms of what kind of support do they need or expect from you after the session. Now, another thing that will also help you have a better picture would be to find out what have they been previously doing to solve the problem. This information is important for many reasons, but how is this information important to you in terms of their expectations? Well, if they have been working, for example, on their presenting issues previously, you need to know what kind of work specifically they have been doing, because their expectations on how you should be supporting them could sometimes be well based on their experience in previous therapies. Examples could be if they have been brought in, like, for example, every second week or every week for some certain, for the same certain problem, or a related trigger after a session. And speaking of triggers, in the organic conversation in hypnotherapy, we address them in the end of the session by testing the client's resources then and there before closing the session, or whenever a different resource for closely related problems come up. So it's like addressing multiple problems at the same time. Not saying here that that is always in a single session, but in a session anyway. However, when you find out all of that, it is the time and place where you tell the client how these sessions work differently from their previous experiences, if that is the case, and how you can support them afterwards. And that be in a brief, understandable language. So, as much as it is up to these people now if they are going to accept working with you or not, it also comes back to us if it is within the scope of practice in dealing with what the clients present or need, and as well if they want to, if as well you want to sign them up or not. So it is a clear picture, a clear work. If you think about it, this kind of approach is making a big favor in multiple avenues, actually, because in a way it introduces choice again. And no matter how much or not are we impacted in acting from what we are being told over and over again, still deep down, whenever we are specifically told to do something in a certain way, nobody likes it. That is sometimes a reason how the clients resist to work with a technique or a certain coaching, even though they might ask the therapist to tell them what to do. Now, to come back to the topic, let's say the parameters are clear, you start working with your client, and the session is done. The last part of the talk, after you finish the session, meaning really after your session together is done, that is, the client is out of trance, you tell them then nicely and clearly how could the process of learning whatever they learned from that session is going to go. Notice I said could, not necessarily it would. So you would need to read the cues of the client, being if they are being still zoned out or more aware also. And I say this to say that because we know a trance-like state is occurring organically, where there is an absorbed focus, you should notice that. One helpful way to bring them more into their awareness is by asking them simple grounding questions that bring our awareness fully in the present moment. So, and that is the perfect time to do that, like bringing the person in the present moment. And that those kind of questions can be very simple one, like what time is it where you are? It could as well be a reason to laugh instead of leaving an impression that you are in a hurry, because sometimes when working online, you could very well be also in the same time with a client. So you have the idea. And now bringing them to the present is actually very helpful after they have really untied so many knots that prior to the therapy with you were pretty tight. Therefore, coming to the present has been difficult for the clients for a long time. And the reason to come to more of an aware state of mind is also for them to be able to clearly hear what you tell them about after the session, and not to risk taking it by mistake as a suggestion. Speaking of change, how, whatsoever, whenever that happens in people's life, not necessarily because they decide it, there will be that obvious physical or mental, or sometimes both type of obvious changes. Not always is exhaustion. Sometimes it's spark. Sometimes could be euphoria. Sometimes it could be weird cravings. Sometimes if it's something that left a really good imprint, like when people suddenly fall in love, by next moment their complete appearance changes. So whether with or without you, any type of change in people's lives is going to somehow produce something different from past ordinary, whatever their ordinary has been. And if it goes this way, the next best thing to tell the client is to go to sleep, if that is possible, as it speeds up the process in time, or do something else completely so that their mind will be occupied with anything else rather than the session for it to have a place to land. Now, you can take this moment as a moment also after, some close relation, or intimate time, because it can take a lot for someone to open up in that level around their problem. Though in conversational hypnosis, it is not necessary as much, to know everything. They can look so different, those sessions, from one another. Uh, But as a natural phenomenon, after opening up with someone and working through delicate things, a sleep is most natural option for the mind to reorganize, rest, and rejuvenate. Or in other spectrum, as for example, after an injection, the physician will allow the patient to sit a bit before they let them go outside and start walking right away. So you have the idea. And if the session happened to be very long and somehow both of you, you and the client, are exhausted and no words pop up anymore, it is the time when it's okay to tell the client to rest, sleep, or do something else. And once they wake up, to let you know briefly how they feel. And that is the time when you can tell them what to expect or not after the session. And after it, do not interrupt the processing time any longer, but let the client reach out if they need anything else after things land better, so you know where to go from there afterwards. Or it may happen that that has been all. So the reason I made this video a bit in a longer format is because not everyone uses conversational hypnotherapy, so you have a better idea and can use your own skills and creativity if you decide to explore this, possibly in helping you manage your clients' expectations better. So thanks for listening now, and see you soon in another video.